got up to 93% of dental professionals that are suffering from some form of musculoskeletal issue. And that might be low back pain, it might be upper back pain, it might be your shoulder, your neck, and all the hand stuff, which I think totally goes overlooked. Numbness, loss of grip strength, tendonitis, carpal tunnel. Unfortunately, everything that we do, from the way we sit in the tight spaces we're trying to fit in, and all the vibration and force that goes through, whether it's an ultrasonic or a handpiece or whatever it might be, all of these things over time, it's not that you're in a tough position or doing a lot of work that puts stress on your body for a short period. Is that you're doing it constantly every day for years and years, and that's why we start to break down.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor Business Media production. This is episode number 394. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. In this episode, we have Dr. Shamardi coming back again, and this time we're going to be talking about musculoskeletal pain as a kind of a piggyback episode to his re-released episode a couple weeks back on hearing loss. As dental professionals, our bodies are always taking a beating. And I feel like Dr. Shamardi in this episode helps us to understand the things that we're doing that cause us the most issues with this. But then he gives us some tips to help us alleviate or maybe even prevent these painful issues from happening in the first place. Next week, we have on Val Dangler on the show. It's been a long time coming. I'm very excited for you to listen to her. She is one of the most amazing hygienists that we have. We recorded her episode at RDH Under One Roof. And a theme you'll start hearing as we come into the interview portion is that we are on the floor of Under One Roof. It's kind of loud. It's this and that. I remember one time there were some vacuums going because it was between sessions and the vacuum people were going. So I can't remember exactly. I think it was a little bit quieter with her episode, but just stick with us as we have some background noise about the excitement that was at RDH Under One Roof. But the thing that we talk about with Val is pretty much her journey in dentistry, which I think is unique, but it's also hopeful. One of the things that sticks out about her journey is how versatile the dental hygienist is and how many options that we have open to us outside of the clinical practice. We also talk about the importance of being mentored and having mentors in our lives and mentoring others. So I can't wait for you to listen to that episode. That's it really for me this week. Short and sweet. Be sure to subscribe to the show, share it with a friend. Dr. Shamardi will be posting some really useful supplemental posts on his social media about today's topic. So be sure to go and check out his pages. With that, have a great week, everyone, and enjoy this episode with Dr. Sam Shamardi.
A tale of two hygienists.
Everyone, I'm so excited. Welcome into the interview portion of the podcast. We have Dr. Sam Shamardi on again. Dr. Shamardi, thank you so much for making the time today.
Thank you so much. Great to be back.
I will tell you, I have lots of things I want to ask you before we even get into our topic today. We re-aired the episode that we did, what was it, a year and a half ago. Surprising how many people were like just super interested in that. Tell us a little bit since then, what's your journey been? Because it's been a year and a half since you've been on.
I know time flies. Journey's been great. Still practicing as a periodontist. Still doing a considerable amount of speaking. Still big on the education, traveling literally across the country, speaking everything perio, but still doing a lot with the hearing loss. A lot of finance, especially for new grads and early career professionals. So I'm really excited about that, and actually launching kind of like a little masterclass type series of courses that'll really kind of give new grads, early career professionals, really an A to Z for everything, kind of getting your career started, pain management, finance, all things perio. So trying to really create a unique experience. And the big thing is really just helping people out and sharing the story. I mean, I'm at a point after all these years practicing, more than I want to admit, where I'm kind of pretty flexible in my career, able to do all of this stuff and have the time to do it and be able to, afford to do it. So it's possible for everybody. It's just a matter of having a little bit of guidance. And that's just kind of what I'm trying to help bring and help everybody get to the place they want to be.
I love that. There's so many people that are out there that are kind of in your same boat, right? We have this, I don't know. I feel like, when we were going to school, we had this, oh my gosh, like we have so much longer before we can get out of debt. We have so much longer before are at that we can take a family vacation even, right? Like we're so stressed by all this. And then as time goes on, there's kind of two paths that I've seen happen at least, that the one that when they get kind of set or, comfortable enough that they can do what you're doing, they're like, okay, I'm gonna just slowly like Homer Simpson into the hedges, right? I'm gonna slowly walk backwards. And then there's some that just lean into it and say, like, look, I got there. I would love to help other people get there as well. I saw a post on, I want to say like dental nachos. It was some one of the dental groups, and it was about, I think, real estate of all things. And they're kind of showing how, hey, if you want to get into real estate, here's all these things. What's out there for dental hygienists though, as far as like additional things that they could kind of tap into? Because I feel like dentists have a lot of things. What do we have?
It's true. A lot of this stuff, they direct more towards dentists, but I think on my end, a lot of the stuff I speak about, I always highlight, using the term dental professional.
Hmm.
Uh, Again, I think too many of the things, even though a lot of those same things, I mean, you even mentioned real estate. I mean, that's one thing that doesn't have to be limited to dentists. There's no reason why a dental hygienist couldn't be getting themselves involved in that as well. I think it's just
Mhm.
more the assumption in the market that people are more focused for dentists specifically, but I think things apply completely to them. I mean, what we're going to talk about today with some of the pain management stuff, the loan payback stuff, and even just the general perio stuff. I mean, all of this applies just as much to any dental hygienist as it does to any other type of practicing dentist. So I think the sky's the limit in terms of options, and dental hygienists are in the same boat that we are.
Absolutely. Before we get into everything, hearing loss. What's our update on there? Because I saw the email that you had posting. Congratulations for selling out on that on the ear aid. Right, it was the product. You're still speaking about it though. You're still really passionate about it.
Absolutely. This is about 10 years now. I've been that I launched the product originally, and still speaking about it as often as possible. Actually, waiting for hopefully another publication sooner than later from Endeavor coming out on the topic, and still very passionate about it. In the process of trying to partner with a manufacturer to kind of create a more updated, new kind of version of it, to be able to hopefully relaunch at some point. Again, like you mentioned, people hear the podcast later or come across an article and they're reaching out and saying, "Hey, what can I do?" So I think the interest is no doubt there. People still suffer from it every day, and it's still a challenge of educating people and making them aware of how important of an issue it is, and
Mhm.
hoping to bring another iteration of a solution to them.
Well, I know you will. I know it'll be amazing when you do. I guess for our listeners, if you haven't had a chance to listen to that episode, we've aired it twice now, but go back and listen to it again. It's in your recent feed. So make sure you're subscribing, do all of those things, because this episode's going to go out here probably next week. So we're going to try and have you like maybe only 2 weeks back to back, or maybe every other week, whatever it was. My last question before we jump into kind of our topic today is, when we were doing kind of brainstorming, you said, okay, what would you like me to speak about? Here are my things. And for a periodontist, they're not really exactly tied together, doctor. You have artificial intelligence, musculoskeletal issues. I think in pain management was one of them. We talked about before we mentioned like perio protect, lasers, non-surgical perio things. These are all over the place. How do you keep your mind active? Like how are you searching for all of these different things that interest you?
Yeah, I think a lot of it is really trying to just focus on things that kind of give me a practical solution to my day to day. So it's all about finding things that help make you do your job better,
Mhm.
that help you be more efficient, and that lead you to the direction of wherever you're trying to go. So for me, it's been all about trying to improve as a clinician, but also trying to improve from a business standpoint, trying to get to a point where I am paying off my loans quicker and more efficiently,
Mhm.
being able to have more of a flexible lifestyle. And I think at the end of the day, none of us mind the clinical stuff, but it's more the pressure that comes with it, and some of the sensation of just a lot of force and pressure and having to do things in a short amount of time, and the stress that comes with it. And I think all these different types of solutions that I speak about, these are all different categories of areas of practice or products or whatever it might be that basically make you do your job better and free up your time and help you just be more efficient. And that's kind of how all these things tie together. And of course, for pain, it's about how can you get yourself out of pain so you can do your job and not be suffering and be able to practice for a longer period of time and have a better quality of life.
Well, let's jump right into that. So, musculoskeletal issues, pain prevention, that's kind of the topic that we want to address today. Where do you normally start in this conversation?
Well, the easy part with this for us, unfortunately, is that you can pretty much start anywhere because any dental professional, hygiene, dentist, doesn't matter what type of specialist you are. I mean, except maybe ortho, but you're all in pain,
Yeah.
and I think that journey starts pretty quickly when you start practicing. You're in school, you're treating maybe one or two patients a day. Now you come out in the real world and you're treating up to double digits a day, and it starts pretty quickly and it starts everywhere. Dentists, you can quote tons of different studies. You got up to 93% of dental professionals that are suffering from some form of musculoskeletal issue. And that might be low back pain, it might be upper back pain, it might be your shoulder, your neck, and all the hand stuff, which I think totally goes overlooked. Numbness, loss of grip strength, tendonitis, carpal tunnel. Unfortunately, everything that we do, from the way we sit in the tight spaces we're trying to fit in and all the vibration and force that goes through, whether it's an ultrasonic or a handpiece or whatever it might be, all of these things over time. I mean, it's funny, this segues perfectly with hearing loss because we highlighted the issue of a chronic condition where you're exposed
Mhm.
to this problem consistently over time. And it's the same thing with musculoskeletal. It's not that you're in a tough position or doing a lot of work that puts stress on your body for a short period. It's that you're doing it constantly every day for years and years, and that's why we start to break down. So they really go hand in hand.
Let me ask this. So, one thing that's big in the hygiene community, in dentistry, I think from a doctor's standpoint, I think it's more about production, but assisted hygiene. When I was practicing in a couple of my locations, I loved it when doctors just loaded up my schedule and they said, okay, look, you're going to be doing, this in this room and then this in this room. And so rather than having the 8 patients in 8 hours kind of situation, I didn't mind as long as we had enough, assistants and people to help out and do all the things to be able to bounce around to 12 to 15, operatories in a day. And even when I did restorative hygiene, I loved going in, giving anesthetic, walking out for a little bit, coming in, doing something else because I felt in my mind, it made more sense that I wasn't doing that repetitive motion as much. But conversely, you're kind of doing the same. You're doing more. You're doing more work. Is
Yeah.
there something to be said about assisted hygiene? Is that good for us? Is it maybe not good for us? Something I'm missing?
Yeah, I mean, I think you hit one of the points on the head. I mean, in one sense, you think you're breaking things up, but at
Yeah.
the end of the day, you start looking at things and realizing, wait a second, I'm actually in some ways doing a little bit more. So I think it's a matter of taking a look at what your total day is including and trying to maybe kind of break it down and see what it is, and then start to get a grip from there and be like, am I actually doing double the work? Am I doing more or less? And it comes back to kind of this conversation of being efficient, but also being effective, where you're doing that for the purpose of maybe breaking things up, but you also have to see if in the long run you're actually doing more. And there
Mhm.
are ways to maybe adjust things so you're maybe not doing quite as much, or if you see, it's a give and take because you might see, well, I might be doing a little bit more through the course of the day, but just the fact that I'm getting up and having a mini break or being able to stretch or be in a different position, you can set it up in a way where you can make it have less pain and less tension on your body. So you can use that to your advantage, but you really just got to identify what it is first, and then from there figure out and plan a way to actually deal with it to make it work to your advantage.
You mentioned stretching. I feel like we see that a lot in the, hey, take those 3 minutes, stretch everything, do all the things. I can't imagine that's the end all be all for prevention though. Like what are the things that we need to be doing to prevent more of these issues from arising?
Yeah, no, great question. I mean, look, yoga, Pilates, all the stretching stuff, it's can't be said enough. It's huge. It helps immensely. Everybody should do it to some degree or other. There's no doubt. But like you said, that can't be the end of the road. For me, especially, I can tell you from experience, 5 years ago at this time, my hands, my grip strength was reduced in half. Had numbness. I was at a point where I was thinking, my God, I might not even be able to practice much longer. It was pretty scary.
Yeah.
And, it's something a lot of dental professionals and hygienists go through. And I think, again, our hands, our neck and head and back and all that, of course, but I think our hands are greatly overlooked. And whether you're using an ultrasonic, just the vibrational issues and the way the vibrations translate and go into your hand and then into the tendon and muscles and to the nerve endings. There's plenty of studies I can, highlight that show that constant stress on those nerve endings over time start creating issues. And then that's what leads to the discomfort and the numbness and the carpal tunnel. So for me, on top of the stretching, I think the things that help considerably, believe it or not, number one, acupuncture has helped me immensely. I was not somebody that thought that stuff was really real, more or less, and was
Yeah.
very hesitant until 5 years ago when I was really getting scared and I started doing the work and saw a dramatic improvement. So that's helped me a ton. And then something that I think people would not think would be as helpful is also weights. So you would think, well, if my hand is sore, if I'm going to start doing weights, well, that's going to kind of make it more sore. But you can
Exactly.
actually be doing specific exercises that are strengthening those muscles that are have become weak because of the amount of work that we're doing. So different type of weight exercises, not only for your hands, which I just was discussing, but I try and go once a week now and do some specific weight exercises for your what they call the posterior chain. So that's kind of more your low back, your backside, your legs, and your core. And you think of weights, and everybody's thinking of the bougie, trying to get big arms and biceps and this and that, and
Exactly.
they completely avoid that posterior chain. And in fact, that's the area where we can protect our lower back. That's the area where we can give ourselves a stronger base to make ourselves our core better and our upper back better. And since I've been doing that on days when I get into positions that used to cause me discomfort for days after, now, I mean, I don't have those problems anymore. It's gone down so much where my pain issues are not even in the same league that they were before.
Now, is this something you had a personal trainer to help figure out, or you just watched YouTube videos, or how did you figure this out?
Yeah, so I actually in one of the buildings that I practice in the building there's actually a personal training studio, and I worked with one of the trainers there who's awesome, and he really showed me some of those exercises. But it's important to point out that it doesn't require that. So you can of course go learn some of this stuff, and I'm actually and we'll discuss that later. Going to be highlighting some of that later on social media to give people share some of those lessons. But once you kind of learn some of those techniques, you could be doing that on your own at home if you have some weights, or obviously you can just go to a gym anywhere and do those exercises there. So it's something you can definitely do on your own.
I wrote down here because I think this would make a really good, like, short, maybe 7-minute thing on acupuncture. I'm deathly afraid of needles. I don't mind giving people like shots in the mouth. Obviously, that's no problem. But acupuncture, it doesn't make sense in my head. Do you know how it works?
Yeah, I mean, it never made sense to me either. But basically, and I'm no expert at this at all, but we've got, these different nodes all around our body, and there's these pathways. And obviously, this has been around for thousands of years. I mean, this is ancient kind of Eastern medicine, so to speak. So, at the end of the day, our nerve endings and these pathways all are kind of connected, which should kind of make sense for us because we talk with our patients about how everything in the mouth and the blood flow and the pain is related to the rest of the systemic body as well. So they basically identified these different pathways through our body where we can connect different pain areas and different parts of the body with different areas as well. So they can access those pathways, increase blood flow, and basically create these situations where they're kind of releasing that energy. And really it again, I don't know how, but it really is effective. It helps take that pain away. And I can tell you, like you said, I'm using needles all day long on patients. I'm not a big fan of them myself. I can still tell you when they're putting it in for like my hands, for example, and I share some of those pictures on social media, and I will be again. I'm not sitting there watching them put it in. I'm kind of preferring not to look, but Believe it or not, it isn't a painful thing. And even when it's sitting there, yes, it's kind of awkward, but there's no actual pain involved with it, which I was worried about, but was like, okay, great, this doesn't hurt. And then, like I said, it's bizarre. It ends, and a day or two goes by, and you just start to notice an improvement. It's like going to the gym and you're sore for a day or two after. It's telling you, hey, you're getting in shape. You're not sore from doing acupuncture, but that area that you got work on, you start noticing a couple days later, things start to feel a lot better. And like I said, it was a massive change for me.
It's interesting. Let me ask this. So, I feel like with every specialty that they have different, habits and behaviors and things that they do. So you as a periodontist versus a hygienist versus, well, we're probably more similar than probably general doctors. But what are you seeing as far as kind of the breakdown of the body for each of the groups?
Yeah, I do think there is a lot of overlap. Perio and hygiene more than any two for the hygiene world. In general, there's a lot of overlap, but I think some of the things that are common for all of us is that your non-dominant hand is grabbing the mirror. So
Mhm.
whether you're retracting the cheek or you're retracting the tongue, or in my case, if you have a flap and you have to hold that flap in place, your non-dominant hand, it's important to note that that non-dominant hand is the one that is stationary. So a lot of those issues, so there's a specific joint in your thumb called the CR joint. And there is a kind of a tendinopathy, a tendinosynovitis type of issue, an inflammatory issue of your tendon that happens. Because what's happening is when you're constantly holding that hand in a stationary position, keeping the cheek retracted, keeping the flap retracted, whatever that is, it requires force. The patient's
Mhm.
being resistant, the tongue or the cheek, they're pushing back, and you're having to keep that cheek retracted to be able to see. Well, if you're holding that hand in that stationary position for a long period of time, that joint is kind of locking. So when you're doing that, the amount of pressure that you're putting on that joint is over tenfold of what you're putting on that instrument. So that force is translating onto that joint. And again, doing that for hours at a time, for a long period of time, is creating wear. So when I was
Mhm.
doing 6, 7, 8 surgeries a day and constantly holding flaps, it started creating weakness. So you would think my dominant hand, in my case, my right hand, which is doing all the extracting and the drilling and the dirty work, would be the one that would be weaker. But in fact, because it's at least moving and doing more different things, it was a little bit stronger than my non-dominant hand, which was stuck in one position in a
Mm.
fixed place a lot. So I think that's something that gets overlooked a lot. So it really has to do with both hands. So for hygienists, the non-dominant hand will still have that stationary issue. And then the dominant hand, again, in a hygiene case, we talk about ultrasonics all the time. That vibrational force that's going through the hand and the skin and onto those nerve endings and the tendons, that's causing stress on those over a period of time. And again, forget the ultrasonic. If you're using the hand scalers, my God, I mean, that's even more now because now you're including the carpal tunnel because of the wrist and the nerve that's going through that little tunnel starts to get pinched, and that's where you start getting the carpal tunnel issues. And same thing, the way you're gripping those scalers, and you're having to grip it with enough force when you're trying to remove calculus or whatever it might be. Again, that's also that constant repetitive wear over time. So all of those things, whether it's your dominant or non-dominant hand, unfortunately, our hands really get a beating.
And they don't have any sort of like, it's going to impede probably our motion, but any sort of like a glove or something that can either absorb those vibrations or help, keep that thumb a little straighter or not straight, depending on what it should be. Like, there's no products out there that would help with that.
Yeah, it's a great point, and I'll mention a couple of things. I mean, it's tough product wise because even when my thumbs, I started getting a lot of that weakness and was losing that grip strength. They had created a splint for me, but
Hmm.
the problem is when you've got a splint on and then you try and put gloves, patient gloves, over that, and then
Right.
actually try and do the dentistry. In my case, trying to do a surgery, it's really tough. So that's why you really got to emphasize getting the treatment and doing those exercises. But the one practical clinical solution I'll give away to everybody that you should do is the instruments that you use. So what people don't realize is that I hate nothing more than opening a basic cassette and seeing that really skinny mirror. That absolutely kills me because the skinnier the handle of your instrument, and it doesn't matter if it's a mirror or if it's a scaler, curette, whatever it is, the skinnier that is, the tighter your hand has to grip that. Think of a
Hmm.
pencil that's super thin versus a very bulky one. So the tighter you have to grip that, the more compression that you're creating on that joint and on those tendons and that muscle. So the practical solution to everybody is whether it's your scaler or your mirror, get the fattest handle you can possibly get. And you'll be able to see right away if you're using a mirror that has a really fat handle, not only are you able to grip it more comfortably, you have less pain and discomfort, but you're also having to use less force to keep the cheek retracted. It's the same thing with that scaler. If it's got a bigger handle to grip, you can also kind of grab it more comfortably, put less pressure on your hand, and you can still generate enough, if not more force when you're doing your actual, clinical work.
Let me play devil's advocate to that, doctor. So you would think though, the bigger, fatter one's going to also weigh more. No, so don't you? Are you
So
replacing one problem with another problem?
yeah, so not too much. In other words, the bigger mirror, the weight difference is really pretty negligible. Even though the
Okay.
handle's bigger, it doesn't necessarily mean that the mirror itself is super heavy. So you can see that with different hand pieces, for example. So there's different hand pieces that might be different sizes, but the actual weight of the handpiece, depending what it's made out of, it could be a lighter material. So it doesn't mean just because the handle's bigger that it's necessarily going to be heavier. There instrument companies that will have lighter ones than others. And like I said, just the offset of what you're doing from the pinching motion,
Mhm.
because your hand isn't getting the joint and the tendon isn't really getting the damage as much because there's a difference of, and I'm making up a number here, but a difference of like, a half a gram of weight as opposed to the amount of force that you're putting from the actual pinching and gripping motion. And that's the one that's causing more damage.
Sometimes I wish this was a video podcast. I mean, mostly for you, because when you're showing that pinching motion, it reminds me a lot of what we talk about with our patients of having like oral appliances, night guards. We're trying to prop your mouth open so it's not causing so much damage. You're like, we want to have our hands open too. It's not so much damage. It's the same like motion with your fingers. It's funny. Let me ask this. Correct me if I'm wrong. I don't really know if this happens in hygiene, but in dental, for on the dental side of it, there's like electric hand pieces and there's other things like that. Are those better, less vibration, smoother, or is it pretty much the same thing?
Great question. Big difference. So I've spoken about the electric versus air driven handpieces on some other webinars. So, I highlight a lot the products from NSK. They make the best handpieces that are out there, bar none. And
Mhm.
why I mention them specifically is not only are they the best, but they are by far the lightest on the market. So we're you just bringing up this topic of weight, and you're not going to find a lighter handpiece that does its job better. And then to your segue to your other point, electric makes a big difference because there is a significant amount of greater torque. So when you talk about an air-driven high-speed handpiece, air-driven handpieces, they have a significant amount of speed, but they don't have any torque. And then what ends up happening is when you're drilling through, it doesn't matter if it's a crown or whatever it is, you actually lose 40% of your speed because of the friction from the
Mhm.
contact of that burr. So what ends up happening is you are actually pushing more on your hand, you're putting more force into it to try and cut through something. But with an electric handpiece, they have a significant amount of torque. And so what happens as a result of that torque is you have this kind of constant amount of power going through. So cutting through a crown or a material, you're able to do it with a significant amount of less energy, and you're able to do it in a significant amount of quicker time.
Mhm.
So when you're doing those hard to reach bridges or difficult material that ordinarily would be beating up your hand, now when you're doing it with an electric, I'm using a quarter of the time and even less of the energy. So again, that translates into so much less stress and pressure with the vibration and the pain into your hand. So that small adjustment by itself can really pay dividends.
Sounds great for dentists.
Yeah.
What do we have for hygiene? Do we have an electric ultrasonic version or anything like that coming down the pike?
Yeah, I don't know about the electric. Obviously, in the world of, the ultrasonic and now with the piezo scaler, they're trying to really market that. However, I don't know, again, because at the end of the day, we're still balancing that out with the vibrational side.
Yeah,
So there
exactly.
is a give and take with that. It'd be interesting to see. I don't know in terms of, for example, removal of calculus, if, having a greater amount of torque versus the vibration. I don't know how that ratio works for products. That being said, one example of maybe doing something that's a lot quicker is air polishing.
Mhm.
Using, the airflow is a huge difference. So you can remove. We talk about staining, for example. So the amount of time and energy you're going to take with an ultrasonic, not to mention with your hands, removing staining on a patient that's a smoker or that was, using a ton of Paradex, using an air polishing or an airflow product, whatever it might be, to remove that same amount of staining, you're going to be doing it in, significant amount of less time.
Mhm.
It's a lot less on the patient. The patients enjoy it more because they don't feel like, as they say, oh, I'm not getting scraped, quote
Yeah.
unquote.
Yeah.
And again, all that force that you normally be putting and the vibration, now you don't have that also. So that would be my best analogous example from a hygiene standpoint of an easy kind of solution.
I think that, and it's so like topical. Everyone wants to, yeah, we were just at under one roof. Like that was like one of the bigger topics that people were talking about was, airflow. And we're at 30 minutes now, and I feel like we've barely even touched, the surface of what you want to talk about. Is there something that I missed asking you that you would love to talk about?
Pain wise, no. I think the big thing is, get bigger handles. I think that'll help a lot. Take a look at the weights, and there are, different products and materials that are lighter than others, regardless of size. So focus on that. And again, look into stuff for your hands and for your posterior chain. Do some weight exercise. Again, I'll highlight some of those on social media that will help stabilize things and take care of your hands. Look into whatever you got to do, stretches, acupuncture, weights. The stronger you can keep those, at the end of the day, as we say, they're our money makers. They're what we have to use and protect. So we should do more for that in addition to everywhere else.
No, doctor, I love it. Where can they find you on social media?
So on Instagram, the handle is just at Dr. Sam Shamardi. So that'd be the best place. Also, just on my website, drsamshamardi.com. So any updates on materials, videos, all that type of stuff, lectures and whatnot, will always be there. Be the best place to find me.
Doctor, you are the best. Thank you so much for being on. We'll definitely have you on again, probably next quarter. Let's just keep doing this.
Sounds good. Thanks so much. Love being here.
All right. Thanks.
Yeah, this is oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.